Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be talking about super absorbent dressings for chronic wounds and why they are so important. But first, if you could hit that subscribe button, it would be greatly appreciated as it does help my channel reach more people. So let's get started. So why chronic wounds often fail to heal? Okay, so moist wound healing is the current cost-effective, evidence-based practice for faster healing rates, decreased pain, and decreased infection rate. Okay, so that's what we always want to do, is have this moist wound healing. Now, acute wounds, so these are wounds that are able to heal within that 4-week period. They produce an exudate with growth factors and they support tissue growth in the area, okay? So the exudate of acute wounds is different than that of chronic wounds. Now, chronic wounds, the exudate contains inflammatory producing exudate. Okay, so this keeps it in an inflammatory state and it's quite destructive on the fragile wound bed. Okay, so it doesn't allow the wound to heal. And so if we're keeping this exudate on the wound, it's going to actually keep it in this inflammatory phase and it's not going to allow the wound to heal. Okay, that's why chronic wounds are really, really hard to heal. Because they're just stuck in this exaggerated phase of inflammation and high exudate levels that's keeping it there. Okay, that's why we need these high absorbent pads to be absorbing it. Okay, and where it's not sitting on the tissue, breaking it down. So what are super absorbent dressings? So really the name says it all. They absorb an extreme amount of exudate. Okay, I actually want to do an experiment, so I'll be doing it soon. So watch out for my next coming videos. I want to see how much fluid these dressings will actually hold and compare them all so people can actually see how much they hold. I was actually quite shocked myself, because I do have one here. They're super hard to see on here, but one side's blue and then this is the absorbent side. Very, very soft. It has a hydrophilic covering, so it absolutely just loves water, exudate, anything liquid, and it absorbs everything, while still keeping the wound bed just like eyeball moist. Okay, so they're quite awesome in that aspect, and they can hold a lot. They can also be put under compression wraps or stockings for extended wear time. But I mean, these hold an extreme amount of exudate and it pulls it into the inner layer and it just locks it in there. Some of them do have like a diaper technology. So you know how like diapers work, it just kind of locks it all in the middle, and it keeps the baby dry. So that's kind of the technology that the super absorbent dressings do have. So which chronic wounds can be treated with a super absorbent dressing? So considering that they're non-adherent, they are hydrophilic, so love exudate, they're highly absorbent. You know, when we're thinking about this, we want to use it on wounds that are chronic, that have high exudate, okay, that need to be able to absorb large quantities of exudate, which a lot of chronic wounds, they give off a lot of exudate. Okay, so these super absorbent dressings are very beneficial to any chronic wound that is putting off a lot of exudate. So it could be venous ulcers, pressure ulcers, graft sites, incisionals, burns, lacerations. Like, it can really be a vast majority of any wound that doesn't want to heal and has high amounts of exudate. So like I was discussing before, why is chronic wounds exudate considered so harmful? So with the acute wounds, it promotes healing. With chronic wounds, it has a high level of destructive enzymes, protease, cytokines that prolong the inflammation stage. It just doesn't allow the wound to actually start healing. So it starts breaking down the granulation tissue and impairs the actual healing process. Okay. This wound exudate is very thick because it has a high levels of proteins and white blood cells and bacteria in it. So we have to be cautious with that too, because we don't want this thick substance on the wound bed, okay? And it can also break down the peri-wound too. So that good tissue, the peri-wound surrounding the actual wound itself, if this is sitting on there, it's going to break down the good tissue too and make the wound even larger. So how do superabsorbent dressings help heal chronic wounds? So inflammatory cells in chronic wound exudates bind easily to the superabsorbent dressing and they become locked in the highly absorbent core, okay? Wicking harmful bacteria and inflammatory mediators away from the fragile wound base. Okay, superabsorbent dressings can absorb a large quantity of exudate while keeping the exudate securely locked within the dressing core. Okay, it's made up of multi-layers of absorbent powders and gelling agents, protected by a water repellent backing layer. Okay, this feature enables superabsorbent dressings to absorb high levels of exudate without adhering to the fragile wound base. Okay. So are superabsorbent dressings cost effective? Because they are quite expensive to buy, but they actually, it works itself out. They are cost effective because they're used for a prolonged extended period of time. So these chronic wounds that have high amounts of exudate, they might need to be changed 2-3 times a day because nothing is absorbing all the exudate fast enough and well enough at the level that's needed, so we keep needing to change the dressings. So they have longer wear time, they can absorb more, the wound can be left undisturbed, okay? So every time we're taking off a wound dressing, we're cooling down the wound, okay? And it can take up to 4 hours to start healing and get to those healing temperatures again. So if we can have longer wear time and have that temperature in a longer period where it can actually heal, where it's at healing temperatures without being disrupted, then we're going to have that wound heal quicker, okay? So it speeds things up, and in the long run, it is a cost-effective method. So really, in conclusion here, is that chronic wounds, they have high amounts of exudate that we need to be controlling and making sure that we're not having that exudate sitting on a wound because it's just going to break it down further, okay? So we need to be using our superabsorbent dressings to actually get the wound healing that we're looking for, okay? But that's all I have for this video, guys. I hope you did find it helpful for your daily practice, and I hope to catch you in my next video. Bye for now.